Change the top.
If I can get there. I know you all are always happy to see me come.
Welcome.
And, next year I'll try to bring an easy bill to vote on. In all seriousness, I have spent the last 25 years of my life working in HIV/AIDS, as most of you all know, and taking care of people with HIV. And I have seen the benefit, quite honestly, of some of these patients using marijuana to deal with their pain and agony. What this bill does is compassionate use of marijuana for medical purposes. They would have to get it approved from a doctor, they'd have to carry a card, they would only be allowed a certain amount to use, but I'm here to, this is an emotional issue to me because I have seen a lot of people suffer needlessly from pain, from cancer, MS, seizures, when typical medications such as morphine or other things did not work. And all we're asking is this be part of another option for medical physicians to use in the treatment of pain or other diseases. And it be regulated, so that people don't have to go to their corner, drug dealer and buy it illegally. And this is something that there are now, I think, 13 or 14 states that have done this. I feel very strongly about this because I'm sure like many of you all, we've watched somebody we love in excruciating pain and would have done anything in our power to eliminate that pain. And all we're asking for is for medical physicians to have the option to use this medication. This is not heroin or cocaine or meth or anything else. This is a natural herb that was used for hundreds of years to treat pain. So that's pretty much what the bill does, and I'll answer any questions.
Let me begin by saying, have we had a bill similar to this, or did Ms. Hall not have
Yes,
one?
she
Is
did.
this substantially different
This
from that?
is actually more detailed in how it can be distributed, what people have to have a permission from a physician, they have to have a card, they can only have so much of it. It does allow them to grow their own, just a little bit amount, not enough for distribution, but it's more regulatory than the other two.
Mr. Ward.
This is not to the substance of the bill at all, Representative Todd, but I have an amendment. Let me tell you what it does. It's more drafting than anything else. The amendment would strike Section 1 and Section 2, and the reason being is because this is the policy of the committee that we don't do legislative findings in here. We don't want a statute, for example, filling up with the number of states that have already done this in other states, because that'll obviously change over time. And just for drafting purposes, the amendment, all it does is strike Sections 1 and 2. It won't affect at all the substance of the legislation.
We have a motion, we have an amendment offered by Mr. Ward, second by Mr. Robinson. Any other discussion on this amendment? All in favor indicate by saying aye. Aye. Opposed, no, and the amendment is adopted. Any other questions? Mr. Cobb.
Thank you, Mr. Chairman and Representative Todd. I appreciate the work you've done on this. You're always someone easy to work with. I do have two questions. I'll try and be brief. In reading the legislation, the amount concerns me. 2.5 ounces of marijuana is a pretty significant amount of marijuana. What's the rationale? Is that an arbitrary number, or is that something
Well,
comparable?
I think that's a number we could negotiate with, but if you use it daily for pain, you may be,